Hi there. How are you doing? How are you feeling today? Oh, good. Well, I've been thinking that tonight it would be cool to have a cranial nerve exam, but now we're experimenting and we are doing the kind of cranial nerve exams which are super relaxing, and you can even close your eyes if you wish. How does it sound? Well, I hope that you're gonna enjoy it a lot. It's very, very relaxing. You might even fall asleep afterwards. Well, most probably you will. At least most of the patients fall asleep really, really effortlessly right after this exam. Sometimes even in the process. Okay, I will put on my latex gloves. I'm gonna touch you really gently, I promise. Okay. Ready? Okay, good. Well, so what I'm gonna do is to touch your face really gently. I promise. No need to worry about anything, okay? That's gonna be just fine. Right, so what if I touch your face right here? Can you feel my both hands symmetrical on both sides of your head, of your face? What if I press here right above your eyebrows a little? That's still good. Now what about your neck? Let me just check your thyroid gland, okay? Okay, now once again. Right, this way and out to this side. Alright. Could you please open your mouth and say ah for me? Good. Okay, and now could you please, okay, let me just have a look in your throat for a second. Good. And now your nose. And just to your chin up a little bit. Perfect. Alrighty. Well, looks good enough to me. But still. Okay, you know what? Let me just have a closer look at your mouth and your throat. So I will ask you to stick out your tongue just a little bit, okay? I suppose shouldn't be too hard for you. Okay, I will just use the spatula. Right. Okay. Now could you please put your tongue to either side of your mouth? Wonderful. And now let's switch to the other side. Right. Now I just want to know if you can move it in your mouth. Just like that, exactly. Okay, perfect. Well, everything seems just fine. Now, there are some other things I'd like to test, if you don't mind, of course. Okay, so let's check your reflexes right away, okay? So I have this, I don't know if you can actually see, but I have this nice red percussion hammer for you. Okay, so let's have a look at your wrists first. Just relax, it's gonna be alright. Good. The other one. Good. Now I want to see your knees. To test the knee jerk reflex, I need you to put one leg over the other one. Right, just like that. And now I will keep your eyes closed if you wish. Okay, so now your feet. Good. Alright. Everything works just fine. Exactly the way it's supposed to. I told you not to worry, you see? Okay, well, anyway, now, going back to your face, could you please puff your cheeks for me? Perfect. And I'll puff them and keep them in that position and don't let me close them, okay? Let me close them. Okay. Good. Now that's perfect. Now I want you to keep resisting me, okay? If that's possible, of course. Because I'm so irresistible. Oh my gosh, just kidding. Now, today I'm in my goofy mode, okay? Anyway, sorry. So, please just hold still, alright? And what I want you to do is to clench your jaw and not let me open it, not let me pull your chin down, okay? So clench your jaws, please. Good, amazing. Now give me the widest smile possible. Perfect. Are you sure that this is the widest smile possible? You can do better. Okay, wonderful. Now, keep on looking at me. Okay, good. No, that's fine. I mean, if your eyes are closed, no need to look at me. That's totally fine. Okay, please tilt your head to one side like that. And try to resist my hand. Yeah. Okay. Wonderful. Now the other side, please. And again, try to resist my hand. My hand, yeah, just against your head. Okay, good. Good. Wonderful. So now I want you to frown at me. Raise your eyebrows. Okay. Shrug your shoulders. Wonderful. Okay. Now please try to reach the tip of your nose with your pointing finger. Straighten both of your arms and reach the tip of your nose. Yeah, you keep your eyes closed for that one. Thank you. And now with the other hand. Okay, give me a high five. Good. And now to the other one. Okay, perfect. Okay, now, if your eyes are closed, which they are, I suppose. Well, anyway, doesn't really matter. So, what I'm gonna do is to do some light tests, but they're supposed to work even if your eyes are closed. So, I will only ask you to let me know whenever you can actually feel the light somewhere around your eyes. It's pretty strong, so you'll be able to feel it even if your eyes are closed. Okay, let's do it. So you can feel it actually. Okay, now just let me know. Keep them closed if you wish, and let me know when you can feel the light somewhere around your eyes. Okay. Good. Wonderful. Now, once again, let me know when you feel the light. Okay, amazing. Now I will ask you if you can feel any difference in the temperature of the light. Again, with your eyes closed, it might be a little bit harder to do, but still, you're supposed to be able to feel it. In case you don't, it's still fine. Don't worry about that. So, can you feel anything nothing. Well, actually, yeah, this light, this other one, is supposed to feel a little bit warmer. But again, the difference is not that huge, so if you don't feel anything, it's still alright. Okay, so now I will ask you to try to concentrate and let me know if the light is warmer or colder. Once again, if you just miss it and make mistakes, it's still fine. Okay? No judging here. So was it warm or cold? What about now? Warm or cold? What about now? Okay, so it was definitely cold. God, what about now? So that was warmer. Okay, now what I'm gonna ask you to do is just to let me know which side the light comes from. Okay, if it's from the right, from the left, from the top, or from the bottom. Sounds quite easy. Okay. Alright. What about now? Perfect. What about now? And now. Okay. Now I will ask you to let me know how many times the light goes here and there, okay? Let's say how many times it appears in your field of vision. Kinda. Again, even with your eyes closed, you will most probably feel it. If you don't, no big deal. Okay, like I said, it's an experimental cranial nerve exam, so you knew what you were signing for, so it's alright. Just in case these tests are not really like detailed enough, if they won't show enough information to us, then we will run a separate, really detailed eye exam, okay? With your eyes open, of course. Deal? Good. So count how many times the light appears and disappears in your field of vision. Can you count it now? How many? Oh, good. And now. Okay. And now. 4 times, wonderful. And what about now? Alright, got it. Good. Well, you did really, really good. Okay, now I will ask you to do the same kind of thing. Just tell me now which side the light comes from and how many times it appears and disappears. So it's gonna combine the previous 2 tests, and it might be just a little bit more challenging, but not too much, I hope. Okay. 3 times from the bottom. Good. Four times, and which side was that? Okay. What about now? So, how many times? Okay. Okay. Right. Once again. Right. Okay. Now, can you feel the light again? Is it cold or warm? And what about now? And now again. And now. Okay. And once again. And once again. Okay. Now I will ask you to let me know if the light is moving from the left to the right or from the right to the left, okay? Just the direction of the light. So what was that? Good. And now? Perfect. And now? Again, the same side. And what about now? Okay, great. Good job. Let me just type in some results, okay, the process. I don't want to forget something or just be inaccurate. Dr. Eclipse would kill me. Just kidding. What were you saying? That's good. Oh, that's alright. Your reaction to the light is pretty good, actually, so everything is like the way it should be. Absolutely. No, no need to worry, like I said. Okay. Well, now let's check your hearing, right? Let's do it. So, once start with the basic snap test. I'll make some snapping sound. You will let me know if you hear it, okay? Just nod to me when you hear snap sound. Good. Perfect. Okay. Wonderful. Alright, well, I guess that's. We're not gonna have troubles with that. So now, I will ask you to let me know how many snapping sounds you've heard. Sounds quite simple, which it actually is. So, ready? Let's do it. Good. Okay. Wonderful. Now, okay. Now I will ask you to let me know which side the snapping sounds are on. Okay? Either left or right. Okay. Good. Okay. Good. All right. Okay. Now let me know when the snapping sounds change their direction, okay? Good. Perfect. Okay, wonderful. Now, let me know when. Okay. When you can actually hear the second snap sound, okay? Just not to me. Good. Perfect. Okay. Wonderful. Now, let me know how many snaps you can hear and which side they're on. Okay? Did you manage to count them? No worries, that's alright, I promise. Good. Okay, wonderful. Now, let me just have a look at your ears with an otoscope. I guess we skipped that step. So it's alright. Alright. No, it's alright. Your ear canal is just fine. Absolutely. Okay. Now, test as a part of your ear exam. So what I'm gonna do is to put this tuning fork right behind your ear. And you will let me know when the vibration along with the sound stop. Okay. Good. Stopped. Okay. Okay. Now I will put this tuning fork right on top of your head, somewhere in the middle. And you will also let me know if you can actually feel the vibration and the sounds trickling on both sides. And then also let me know when it stops. So, has it stopped? Wonderful. Good. Now, another thing I want you to do is to let me know if the rhythm is even or not. Okay. Good. You can keep your eyes closed. Okay. And now, listen again, please. You're sure? No, of course. You're right. Good. Now, once again. And what about now? So it was slower, but still similar. Okay, and now finally. Alright. Okay, you're doing awesome. Seriously, just great. Okay, now let's check your sensitivity. I have a very beautiful brush. I'm not sure if you can see it or not, but still, you can open your eyes if you want to see it, but no need to do that. So, it has this pointed end of the handle, which is pretty sharp, and it has this very nice brush itself, which is very soft. Let's call it dull. So we're gonna run this sharp or dull test with you, and you will obviously let me know if it is sharp or dull, if you can actually feel it. Okay, before we check this sharp dull sensations, let's just check if you can actually feel the brush in your face and your skin. Okay, so just try to relax, and I will move it really gently on your face, but you'll be able to feel it if you're supposed to. Good. Are you ready? Could you actually feel it? What about now? And now? Okay, what about now? Okay, great. Now let me know how many brush strokes you felt on your face, okay? Good. Okay, and now? 3 again. Okay, what about now? You know? 4. Okay. Now let's do the sharp or dull itself. It was dull. Good. Okay, and what about now? Okay. Good. And what about now? Was soft dull parts. Okay, and what about now? Good job. Now I will also run the same kind of test, but on your hands and your arms, okay, and other parts of your body. So please do let me know when you can actually feel the brush on your hand, okay? Good. You could feel it. Okay, wonderful. And what about now? Okay. So you can feel it on both hands, both arms. Now I will ask you to count the amount of strokes, brush strokes made, okay? Must be easy. Okay, good. Wonderful. Okay. Good. All right. Good. Good. Wonderful. Well, your sensations are pretty good as well. Everything is just alright, like I said. Good. Wonderful. So now let me just type in some results, okay? Before I forget. Do you feel tired? We're almost done, I promise. We only need to check your sense of smell and taste. So these are the only ones left. These tests are usually so much fun, so I'm sure you're gonna enjoy them to the fullest. Promise. Right. That's fine. Do you have any questions in the process? Like remember I told you not to hesitate. And if there is something you're doubting about or something you want to know, please don't hesitate to ask me, okay? I hope so. No, but I'm serious. Okay. That's good. Okay. So, your sense of taste, let's start with it. Open your mouth. Good. So, there's no rush, just it's alright. So what does it taste like? Peppermint. Right, yeah, okay, let's get this one. No, they look pretty much the same. But I promise it's gonna taste different. Open your mouth. Okay, good. So, what is it similar to? What does it taste like to you? Chocolate. That's right. And now once again, let's do one more. Do you like chocolate, by the way? What's your favorite kind of chocolate? Really? Good. Okay, open your mouth. Perfect. So, what's your favorite kind of chocolate you're saying? No, okay. And what about this third one? What does it taste like? Almond. Ooh, good. You're so specific and so precise. Amazing. Alright. All three. 100%. Good job. Wonderful. And our sense of smell, of course. Okay, well, we have different scents and testers that are going to help us check your sense of smell and your olfactory nerve in particular. So, let's start with this one, the transparent bottle. Okay? I hope you don't mind. So, please give it a smell. Yeah. What do you think it smells like? Rose. Seriously? Okay, you're actually you're actually right. Exactly. Good job. Now what about this one? This black bottle. Okay. Please just take a smell. Once again. It is. So what do you think it is? Apricot. Good job. Right, yeah. Apricot it is. I guess that will do for today. Yeah. So how did you like such format of the test? Good. Let me just work with the results a little bit more. I'll type them all in, okay? You can just relax in the meanwhile. Great. Oh, that's actually good. account that you don't have any complaints, I think that I can actually just let you go. Sure, you can relax and just fall asleep. I'm gonna leave you for some time, and I can even bring you an extra blanket. Okay. Okay. Sure. Do you have any questions? Are you sure? Good. Alright, well, so close your eyes. Or actually, just keep them closed. And relax, okay? Good. I'll see you later. Bye. Hello. I'm sorry to wake you up, but I just need to check up on you every few hours, so now it's time. How are you feeling? Well, you actually look so much better. I can see that good night's sleep and some rest are doing you good. Well, of course. So please tell me, how's it going? What about your headache? Do you feel any, or is it getting better? And what about your eyesight? Can you see me well now? Do you have any signs of double vision? How many fingers am I showing you? What about now? And what about now? And now? And finally, how many? Okay. What if I ask you to look directly at my nose? Can you do that? So please concentrate on my nose, okay? And also, please tell me how many fingers am I holding up? Okay. And what about now? And now, keep on looking at my nose, please. And now. Good. Alrighty. Well, now, can you keep on looking at my nose? And tell me when my fingers leave your vision. Your field of vision, I mean. Now let's try again. Okay. And again. I will put the latex gloves on just for the, disinfection purposes. It's gonna be alright. I will touch your face really slightly, if you don't mind. Really gently. No need to worry about anything. I promise that's gonna be just fine. It's not gonna hurt. Well, at least it shouldn't. It's not supposed to. So if it does hurt, or cause you any kind of discomfort or pain, please do let me know, okay? Let me touch your face for a moment. How does it feel? What if I touch you right here on the sides of your head? Is it alright? What if I press right here above your eyes and a little bit under your eyes? How does it feel? Is it alright? Okay, what if I touch your ears? Just like that. Do you feel my both hands symmetrically on both sides of your head, of your face? Okay. Could you please puff your cheeks for me like that? Perfect. Okay. Give me a smile. That's alright. Now, could you please try to frown at me as if you're angry with me? And act all surprised, like raise your eyebrows. Good. Okay, wonderful. And now, could you please... Okay, no, just if that's alright. Yeah. raise your hand. Try to give me a high five, please. Okay, good. And now raise the other one and give me a high five again. Okay, wonderful, amazing. You're doing good. Now I'll ask you to straighten your arms. Close your eyes and reach the top of your nose, the tip of your nose actually, with one of your fingers, supposedly pointing finger, index finger, whatever you call it. Okay, good. That's wonderful. And now with the other hand. Okay, perfect. Well, now what I will ask you to do is to open your eyes again and please look at me. I'll just flash some light in your eyes. I know it's a little bit uncomfortable and unpleasant, but still I have to do that to check your pupil reaction. That's really important after injuries like that. No, good, that's alright. Could you please follow the light for me? Good. Alright. Good job. Now keep on following, that's alright. Just try to relax and please don't move your head. Just move your eyes only. Perfect. Now could you please concentrate on my nose again and let me know when the light appears in your field of vision. Alright. Amazing, good. That's right. Okay, good. Scan. Scan. Awesome. Okay, perfect. Okay, wonderful. Wow. Seems just fine. Could you please open your mouth and say ah? Okay. Let me just check on your throat once again. Stick out your tongue and say ah. Okay, perfect. Good job. Okay, what about your nasal congestion? How is it going? Let's do a test to see. I have this really thin, delicate brush. I'll put it close to your nose, okay, to your nostrils. So when you breathe out, the passage of air from your nose is supposed to move this brush a little bit. It will be a very slight movement, but I will see it, okay? So please close one of your nostrils, okay? So breathe in and breathe out, okay? And now just let me have a look for a moment. Okay, good. And now with the other one, just breathe in and out. Perfect. No, that's actually good. I could see the slight movement, so it's alright. Well, now since I have this brush in my hands, let's do some sensitivity, like sensation test, okay? Just to see if you're regaining your skin sensitivity. If you can actually feel the brush on your skin. Okay, would you close your eyes, please? Okay, could you feel it? Now once again. Good, now once again. Okay, perfect. Now give me your hand, please. Can you feel it? Good, and now the other one. Okay, wonderful. Good. That's great, actually. Okay, now I will whisper some words for you from ear to ear, and you will just tell me what you've heard, okay? we'll just check your hearing a little bit. Good. Ready? Okay. Let's do it. A brush stroke. Okay. Good. A notebook. Memories. Eyeliner. Hairpin. Okay. Sore throat. Runny nose. Noisy neighbors. Restroom. Spaghetti with meatballs. Okay. 44. Good. 51. 67. 72. 'No, you're right, you can't hear anything because I'm not saying anything. Just trying to trick you. Okay. Raise your eyebrows. Oh, so you have actually done that. Good. Means that you heard what I was saying. Okay. 55. Microphone. Okay. Makeup. Stethoscope. Okay. Well, talking about stethoscope, let me listen to your heart and to your lungs. Okay. Just listen to my instructions, okay? You can relax, it's fine. So please breathe in. Okay. Breathe in and out. Good. Breathe in again. And breathe out again. Perfect. Okay. Now please breathe in and hold there for a moment. You can breathe out. Perfect. Now once again breathe in and hold there. You can breathe out. Okay, wonderful. Now let me listen to your stomach. That's working fine. Do you have any aches in your stomach? Good. Just once again, you can relax. Okay, awesome. Good. Okay, I will just check your stomach as well. Okay, I might press on some spots in your abdomen, Okay, you will let me know if it hurts. So what if I press here? Is it alright? It's bearable. And here. I'm sure. What about now? Good. Do you feel nauseous or anything? And now once again, what about here? Around your liver? Still good. And once again. Okay, I see. Got it, good. Now could you please clench your jaw for me? Don't let me put it down. Perfect. Okay, wonderful. Good. Now please put your hands like that. I will try to also put them down, pull them down. Try to resist me, okay? Good. Wonderful. Okay, now let me check your reflexes, okay? So it's really important for me to see if everything's going just fine. Because in case there is some neurological damage, I need to know. Okay. so your elbows. Good. Now your wrists. Your knees. Good. Now, right. Let me just have a look at your ankles, your feet. Okay. Okay. No. Everything seems to be functioning just the way it should. Good. Now, I'm also supposed to draw your blood for a few blood tests. Yeah. You're supposed to monitor some of these amounts in your the amounts of some levels of the hormones, and also some antibodies in your blood. Okay, so it's really important. So just let's do it this way. Okay, I've got this syringe. Please don't worry. Okay, just try to relax. It's not gonna hurt too much, I promise. You will feel just a tiny little moment and that's it, then it'll be gone. Okay, so just look at me, look at me, look at me, look at me. Do you feel alright? Can you feel any? Okay, just put it here. Okay, perfect. So can you feel any kind of dizziness? Do you usually feel dizzy when you have your blood drawn? You sure? Okay, you're not gonna faint, are you? Alrighty, well, now I have some drops for you that I need you to take. I will just ask you to open your mouth, okay? Stick out your tongue a little bit, okay? I will count. 4, 5. Okay, let me get some more. 6, 7, 8, 9. Okay. Just hold it on your tongue for a little, and then you can swallow it. I'll be able to give you some water, but just in 5-10 minutes, okay? Yeah. Exactly. Are you sure that you're feeling alright? Could you please smell that for me? What does it smell like? Coffee. You're sure? You're absolutely right. Good, thank you. And what about this? What does it smell like to you? Okay. Good. Wonderful. Alright, well. So how are you feeling now? I'm so happy that you're actually feeling better. That's amazing. So, is there anything you'd like to discuss with me? Do you have any questions, maybe? You sure? That's alright. I will just come a little bit later to check upon you and just to run maybe some other tests, okay? Sure. And in the meantime, I just want you to relax completely. Don't think about anything. Everything's gonna be just fine. Of course. Just try to fall asleep again, okay? And I'll get you some water like I promised. Yeah, you absolutely have to stay hydrated. So, I'll take care of But do you need maybe an extra pillow or a warmer blanket? You sure you're not cold or hot? Okay. Would you like me to open the window a little bit? No, it's good. Okay, wonderful. Well, so anyway, thank you so much for now, and I will definitely visit you a little bit later, just in a few hours. Okay? Sure.